Well, you may have noticed that a lot of us are wearing red today, and we've got these little pins on. It's because today is National Wear Red Day. People around the country will be wearing red to raise awareness about heart disease. It is the #1 killer of men and women.
We hope that you will start having that conversation, maybe with family members. You know, this first started 18 years ago, really to highlight what was then a silent killer, specifically among women. Melanie's joining us now to bust some heart health myths that could be dangerous, Mel.
You know, guys, we've been rocking red for a long time for this day because it is so important. And Bruce, you mentioned that pin. I know you can't really see it, but this is the red dress pin. It was created to symbolically represent that women were often misdiagnosed or ignored when it came to heart disease and heart health. Also, since the beginning of this pandemic, deaths from heart disease and stroke have risen significantly. February is also American Heart Month, period. So there are some heart health myths that you should know to protect your heart this Valentine's Day. Heart disease is the leading cause of death globally. In the U.S., someone dies from heart disease every 36 seconds.
A lot of people suffer from heart failure. Over 5 million Americans in any given year will be diagnosed with heart failure.
There is a lot of misinformation about heart disease. One of the biggest is it only affects older people, but up to 10% of heart attacks happen in people younger than age 45. The second myth is that heart disease only affects men. Heart disease is the leading cause of death for men and women. In fact, about 5% of women are likely to be misdiagnosed when they go to the hospital with a heart attack, compared to 3% of men. And our last myth, heart disease is colorblind. Heart disease takes a heavier toll on minority groups.
They were actually dying more than the white patients with cardiomyopathy.
Black people were 3 times as likely to die of it than the overall population. And more than 33% of American Indian people and Alaska Native people die from heart disease younger than age 65, compared to just 17% of the overall U.S. population, separating fact from fiction when it comes to your heart and your life. And just quickly, a story quickly. Just this weekend, a friend of mine, her mother had slurred speech. She called her, did FaceTime with her, and she noticed that her face was drooping and she was having a stroke. Got her to the hospital and everything is fine. Any damage is repairable. So it's so important that you know the signs and you act fast. Okay, one more myth, because if you have a family history of heart disease, there's nothing you can do to prevent it. That is a myth. Actually, people with a high genetic risk for heart disease have lowered their odds by 46% with a healthy lifestyle. Eating healthy, getting regular exercise, and not smoking, all things that you can do to prevent heart disease.